Imagine another epidemic, but let's make it dengue. Sounds frustrating, right? Argentina is experiencing a severe dengue fever outbreak far exceeding previous records. This resurgence is driven by factors like climate change, urbanization, and inadequate infrastructure which create ideal breeding grounds for mosquitoes. To combat this crisis, a comprehensive integrated management strategy has been implemented, and key components of this strategy includes 1. Vector control, targeting the Aedes aegypti mosquitoes, the primary carrier of the dengue virus. 2. Is community engagement, educating the public about prevention measures such as eliminating breeding sites and using repellents. Third is intersectoral collaborations, coordinating efforts between health, environmental, and other relevant sectors. So community education is a critical aspect of this strategy. By empowering individuals, particularly students, to take actions, significant behavior changes can be achieved. This includes activities like workshop and training, providing information on dengue prevention and control measures. And another thing is OV trap distribution, encouraging community members to monitor and eliminate mosquito breeding sites. And another thing is student-led initiatives, encouraging the students as health educators to promote awareness and prevention within their families and communities. So, by understanding community perception, knowledge, and attitude towards dengue, researchers can tailor educational programs to be more effective, which this study aims to assess these factors in Córdoba City and provide valuable insights to strengthen dengue preventive measures. So, the methodology of this study, the project was communicated to the principals and 4 natural science teachers from the relevant institution to ensure unified criteria. After that, each teacher communicated the project virtually to participating students who were taught what mosquito breeding sites were and where show what common breeding sites in the cities such as cans, jars, vases, baskets, containers, pet water bottles, unused tires, toys, bottle caps, folded bags or folded canvas, pop plates, cash pots, and accumulated waters on the surface, draining with standing water or stagnant water rather, any unused containers exposed to the rain. They were also taught about the life cycle of the mosquitoes and watched a YouTube video on the mosquito habitats. So prevention and disease concept were analyzed with them. In addition, they read a local newspaper article with an interview conducted by an expert researcher in Córdoba City. So then the researcher team introduced research with an extensive experience in the subject and doctoral training in biological science, ecology, and nursing, as well as biology PhD candidates. Systematically, the project was conducted in 3 phases. Phase 1. Household survey on the perception of knowledge about dengue, prevention, and sociological factors. And on Phase 2 are the backyard mosquito habitats assessment. And on Phase 3, or the last phase, is the activity mosquito breeding sites elimination. So the collected data were then subjected to descriptive statistics. These approach were used to analyze the quantitative results of the survey through frequencies and percentages. We considered adequate, or the researchers rather considered adequate responses about symptoms, adequate responses about dengue and vector knowledge and educational level coding, and grouping some of the survey responses. So upon analyzing, the result shows that on hypothesis 1, or high awareness of local dengue cases, was disapproved, indicating a significant gap in the community awareness despite the major outbreak. On the other hand, hypothesis 2, or travel risk areas in the summer, was confirmed, suggesting that the travel remains the key risk factors for dengue exposure. So in terms of the perception of dengue risk amongst respondents, although there were awareness of the disease severity, additional efforts may be needed to address the prevention challenges perceived. So in environmental risk factors such as informal waste and proximity to water channels and the river in Sequoia River were reported by significant number of responses. So, dengue fever, a mosquito-borne disease, is spreading more widely, and traditional methods to control the vector mosquitoes have been ineffective. In Córdoba, Argentina, the researchers studied in involving school students in educational projects could help communities better understand dengue and take steps to prevent it. Working with students and their families showed us and the researchers that people learned more about diseases and adapted better practices to stop mosquitoes from breeding. Students' engagement was a powerful way to bring the knowledge into homes, leading to positive behavior changes. This research suggests that including these programs into school curricula all year round might help fight dengue all over areas facing similar challenges. That would be all, and this is my thesis.